Maui's longest running talk show. I've been doing it 30 years. But that's not as long as the senior fair has been going on, 46 years. So, and we're a month out about. It's coming up this year. The senior fair is coming up on Saturday, October 26th, 7:30 to 11:30 at the War Memorial Gym. But we're talking about it a little early this year because there's opportunities to get booths, and it's a huge event. And it's so nice to have Deborah Stone-Walls from the Maui County Office on Aging. You've been on the air before. I've had a chance to talk to you a few times, I know.
Yes, indeed. Yeah. Thank you for having us here today.
Well, welcome back. And also Janelle Kernan from MEO, Assistant Community Services Director and Planning, Coordinating Council Coordinator. That's a long one. Do you fit that all on a card? Can you even get
Surprisingly, they have.
They have?
Yes.
It's a big card.
Thank you for having me here.
It's good to have you. And also ZILPAH from MEO is also here. And ZILPAH, what do you do with MEO?
I work with the senior clubs on Maui. We have over 50-something clubs here on Molokai and Lanai as well.
That covers a lot of territory then. That's amazing. Well, good for you. So this is really something I'm just learning, actually, as I was just talking about this before we went on the air. I was talking to Deborah, and she was saying that this is actually an event that happens all around the country, and it's actually coordinated and has been coordinated as a whole countrywide event for a while, right?
Yes, ma'am. It's actually required by the Older Americans Act of 1965, most recently reauthorized in 2016.
So, and it's got to be interesting because I have to say, I've been on Maui 30 years, and I am so impressed with the senior activities that happen here, and the whole face of what we even think of a senior has changed so radically in the last 46 years. It's very different now than it was when we think back 46 years ago. And Kupuna, honored in many different ways. But just by what you said alone, ZILPAH, it's like I wouldn't have guessed 50 different community groups. I mean, that says something in itself, how powerful and how amazing this force of nature that we call seniors. And I think we really need a better word than seniors now, because a lot of seniors don't think of themselves as seniors,
Right, and they don't want to join the clubs now because it's like, to them it's for the older people, but it really is for them.
So we maybe in the course of our next half hour here, we'll talk and we'll come up with a term that really is acceptable to the whole new face of not seniors, but the new force of Kupuna. Though I have to say, Kupuna is a very respected word still.
It is.
Do you find anyone
is.
I don't know anyone that rejects the word Kupuna, right?
Nope. And MEO hosts the Kupuna Aloha Luncheon every year in July. So, it's something that we feel strongly about, and, celebrating our Kupunas.
Yeah. And it's a respectful term.
It is.
Yeah, it's a time that we honor them.
Yeah. Let me get this mic a little closer here. Oh. Yeah, no, I really do think that, and I love that word, actually, Kupuna. And it's so close to kahuna, which is also good, right? Another respectful.
Just means something different.
But senior, what we thought of as children, because I'm a senior, what we thought of as children as a senior citizen isn't what we think of ourselves now that we are senior citizens. And it's so funny that you start getting AARP things. About 50, at the age of 50, you start getting mailings.
Yep.
And they're very persistent in their mailings. I have to say, I can throw it out, and there's another another email, another mail. It's like, okay, this time we'll give you even more. You can't turn this offer down, right?
It's true.
But and there are a huge block of people who AARP, we see the force they have in voting, right? Mm-hmm. And a lot of special discounts and groups, and they talk about them get together. They have huge conventions with major names and their own magazine and their whole thing, right?
Right, and they do have their own senior club here on Maui. So
I didn't know that.
Kula does, yeah. Kula AARP.
I didn't know that there was an AARP. That's interesting. Yeah. Wow, so they're tied in with the whole nationwide thing.
Well, with our Maui County, County, senior clubs, yes.
Yeah, well, that is something. So what do you feel, being tied in with all of these different organizations for Kupunas, What are some of the major issues that you address and that you will actually bring about and gather when you gather on October 26th from 7:30 to 11:30 at the War Memorial Gym? Are you going to try to reflect some of those issues at this event?
Yeah, I think the organizations that come and take part and have booths there. I know you mentioned there are still some booth sites available for this particular fair. Many of the booths focus on health and wellness, services for seniors, but I think a lot of our push these days is to really try to support. We live in a state with the longest lifespan. So
that's a very good point.
We want to keep people as healthy and as active and as engaged as possible for as long as possible. So I know that the clubs try to keep people socially engaged. They're saying that social isolation is akin to smoking.
That's shocking.
Yes.
Then I mean that's like floors me to even think that's possible. That really. That isolation can do as much damage that way?
Yes.
Wow. Everyone's nodding their heads here. You can't see them nodding their heads, but they are So I've learned something new. So that is a huge factor to address then. If it's as damaging as smoking, just being alone. Because this happens. Women live longer than men. A lot of
Yes,
right?
they do.
That's a fact.
That's the trend.
And some of the kapuna have lost their husbands, and there's these issues of what you go through. At some point, they may not want to get remarried, and they may have to rethink of what their income is. There's a lot of issues. Do you try to address some of those issues? Do you have groups at MEO that tries to address the isolation issues and what happens when they are isolated because of a loss of a loved one?
We definitely, as an agency, do take a look at, the programs that we do offer to the community. We try to be very relevant, for what the needs are. And then, as far as promoting that wellness, and ensuring that, they don't live a life, in isolation, having a senior fair event such as what we have every year, and it's a great connection that we're able to work with Office on Aging, in order to facilitate this entire process. I think when they came up with the theme, to connect, create, and contribute, it really really gives the community an opportunity to not only contribute to the older adults and Americans, but just to make them stronger,
I think that's very important, and what I know, I deal with the Queen Kaimiola Center, and they've been tying in with Blue Zone. And Blue Zone Maui has been extremely active in trying to get people out and walking, and they've been partnering with people and try to get some of these organizations. I think the YMCA now is partnering with them as well to encourage people. And I was shocked when I was talking last week to Amanda at the Queen Kaimiola Center. She said, they now have on their walks they do twice a week. They have a Blue Zone walk around the thing. 200 people now are walking there.
Amazing.
That's great.
That's great.
And they've made friends, and there's groups now, and they're making new friends, right? So that kind of thing is really important because maybe, someone will go, or maybe someone's listening, they go down there and they go to some of these events. Maybe they'll go to these, and they connect with someone and find a way to be involved. And I mean, truly, if it's really one of the major issues as bad as smoking, this could really be a lifesaver, life-changing event when you get groups together to try to do. I know at the Y they do have some, I think it's Qigong or Tai Chi, and I think a lot of seniors like the Tai Chi as well, because I remember when there was Ron Perfetti used to have the Tai
HALE
Chi.
Mahaolu Ilima has a Tai Chi class.
Do they?
Sometimes, yeah.
Oh, that's good to know, because again, that gets them into an easy way of moving. It's not going to be damaging, but you can meet people and feel like you're part of a group, right? So tell us about some of those groups, because you seem to know them real well, that might be interesting for. And are they going to be at the senior fair? Some of these
some
groups?
of them are. We have Kahului HONGWANJI, who's going to do some of their baked goods and stuff they sell there. Our Puerto Rican Association does a table. the Portuguese club does.
Do they do
also.
food too?
Food, yeah.
They do food,
yeah.
okay.
Yeah.
Not Portuguese, being soup by
Yes,
any chance.
yes.
Yes.
Do. And
How did
patele
I know?
plates.
Do they sell out of them? And they
Usually
might.
they do.
Usually they do. I know. I'm not surprised, right? It's so funny. Is there a charge to get into the fair?
Nope.
No,
It's free.
Free.
Well, isn't that nice?
Yes, it is.
And it's
MEO
open.
helps
Correct.
fund that.
It's open to the public.
So do the people park, and I imagine there's shuttle buses and things too for some of the seniors from some of the places, right? But do people park along the football in the backside there, and then they just walk over from there, right?
Yes, we have very brave volunteers who put on vests and have flags
You
and
gotta-
who brave not only drivers but the sun and the
It's
weather.
hot. We've been having
Yeah.
hot. But hopefully
Yeah.
by October 26th, we're going to start to see it cool down. I
It's-
can't wait.
It can be kind of warm in there, so
Yeah.
we encourage people to wear like cool clothing and drink lots of water because it can get a little bit warm. But we do have parking, and this is funded every year by actually the County of Maui.
Oh, that's great.
Yes, so it's part of the Office on Aging, part of our line items. So it really is a community event. The council, has to agree. The mayor has to agree. And then for the last several years, we've been partnering with MEO. So we fund a portion of a large portion, but of the day. But MEO responds with a lot of in-kind. You guys all volunteer, and I think they work for months to get ready.
Really?
Yes.
It's that much work, huh?
Yes.
well, yeah, there's a lot of things to do.
To plan, right? Yeah.
Like,
It's just the
like
planning process.
It's
the
just
booths?
planning.
What do you mean you're planning?
And then
for
looking
all-
for entertainment.
Oh, yeah, you got a lot of entertainment.
And, yeah.
Yeah, that's big time. And then to agree on the entertainment, because for years you've had Judy's Gang, right? And you have performances by Malani, Enhanced Fitness, which is fun, Dance International. Also, Kevin Brown will be there. Kamala, Greg? Greek?
KAHA'A.
KAHA'A. KAHA'A
KAHA'A
Greek.
Greig. Yeah.
Of course, our lovely and wonderful Kathy Collins, we adore her. She's on our buzz station, will be there emceeing. She's so great. And you've got the governor coming over and Mayor Mike Victorino. So all of that does take a whole bunch of planning, doesn't it? A lot of coordinating just to handle those details alone, right?
It's the coordination process, but it's well worth it.
Yeah.
It's always well worth it.
So where do you put the entertainment, inside or are they outside for the entertainment?
They're inside,
Because
yeah.
it's hot otherwise outside, right?
Yeah, we have a stage put
Well,
up.
that's good. That's good. And lots of the chairs, so people want to get
Yeah.
inside and cool down, they can do that, right? So you're serving up. Of course, you got to have chow fun. Is the HONGWANJI doing the chow fun?
I
Who's
can't
doing the
remember
chow
who
fun?
does chow fun?
I bet it's.
I know
HONGWANJI.
somebody does.
And garlic noodles,
Garlic noodles, baked goods.
baked good, all kinds of, and hot
Yeah.
dogs, malasada, poi mochi, and again the Portuguese soup and everything. So, are your food booths full, or do you have room on your food booths for more?
So I believe we still do have
We have room.
You have
Yeah,
room
for food booths.
Yeah.
Yeah.
May I put the word out there that there are many seniors, I won't use that word, kapuna, who are vegetarians. So if you're a vegetarian or you have an Indian restaurant or something that has vegetarian food, it might be nice to get down there and have a vegetarian option. Just saying. And some
That
health
would be
food.
good.
Some health food option. Maybe you can get, some of these whole food or down to earth down in there and give you. And of course, I don't see the I don't see ice cream here. But
I don't know if there's any ice cream.
I don't see any ice cream.
No.
I
don't
Where's
think we've ever had
Rosalani?
ice
No.
cream.
No.
It's probably hard to keep it frozen.
Right.
Might be. I don't know. You know who's always good on that? They have them, the Shaka Pop people. They usually show up. I know they show up at Made in Maui, Made in Maui on November. So yeah, maybe Shaka Pops would do that because they have their own little. It's a little frozen. I don't know. It's kind of like a push cart full of frozen things in Oma. They're good, They're locally made and they have all those great flavors. And
Nice.
you might want to check that. If you're listening, Shaka Pop, This would be, you know, I mean, it's hot, and you have people out there, and there's no other competition for
That's
dessert,
right.
you know.
That's right.
Might be a nice option. Those are delicious. I know they're really popular at the Made in Maui. So tell me about the changing face of Kupuna that you see with MEO and the different groups, and what you see is interesting at this point. There's always going to be some health issues, right? An exercise issue and staying well. You told me about one which is really important, which is the problem of isolation and some of the seniors not getting out.
Well, I think MEO offers the clubs 3 free buses a year. So if you become a club under MEO, you get that, and you can plan excursions throughout the year.
Mm-hmm.
And you have 3 of them. So that's one way of getting them out and doing stuff, and they've been doing it more often now.
Mm-hmm.
So some of them have even gone over to Lanai, you know, to just spend the day.
Well, that's nice. So they create their own little...
Yeah, they can create their own excursion.
And some of them really like hiking. Now, what about you? Do you tie in at all with, not MAKUA, I'm thinking of the other senior center.
Kanoa.
Kanoa? Does Kanoa show up at all, or no? Huh?
No,
Okay.
yeah, we kind of do
That's
a little
separate.
different. Yeah.
Yeah. Uh-huh. I mean, because there's a very, very active community. The only thing is drawing them all together, putting all the pieces of the puzzle together so they can kind of maybe interconnect. Does MEO try to do that, or is that the Office on Aging that tries to handle that?
We do a lot of that, trying to bring people together under specific topic events. And I just want to back up a little, too, to the enhanced fitness. You've mentioned it. Speaking, you know, when we talk about the changing face of aging, about 7 years ago, we implemented enhanced fitness. So that is an evidence-based exercise program that happens in 14 places around Maui County every week, 3 times a week.
Well, I didn't know about that.
Yes. So
Now, this isn't part of Silver Sneakers or that program or anything. It's different from all.
It's different, and what is interesting is when people begin, they do a fitness check. So we see how strong they are, how you know, we measure up and go, which is how fast can you get up from a chair and walk 8 feet and back. We measure the number of arm curls they can do, and we measure the number of times they can go from sit to stand. Now, sit to stand is very important if, when you're older, you want to be able to get off the toilet by yourself. So it really is an exercise program that's designed to help people remain independent.
Now,
and
what part
healthy.
of the Office on Aging, what part does enhance fitness?
I have a program specialist in charge of that program, so our program
And is it at the Cameron Center, down at the Cameron Center?
Yeah, that's my office, yep. So our person is based there, but these enhanced fitness classes happen in community, like at Kahului Union Church, St. Anthony's, Rosalani Place.
I'd never heard of them.
Yeah, some of the Hale Mahaolu housing sites.
So your people go out and coordinate them?
Yes, we have instructors that go out, and then every 4 months, people have a fitness check. So we actually have 7 years of data to show. And this is actually our 7th year anniversary. Next week, they'll be all gathering to celebrate.
Yeah.
But 80%, we have about 400 seniors that exercise every week, 55 and up, and 80% of those people have either maintained or improved their strength, their stamina.
That's amazing.
Their balance, yes. So
I'm really impressed because we do the show that's on actually right before my show here. And they were just, Mayo Clinic was talking about how, I hear every day, we hear about how exercise can help delay Alzheimer's, how exercise can help put off the problems with diabetes. You see this, MEO is very aware of this. Exercise is so key, and that's why I was really excited when Blue Zone began some of getting involved as well. Do you coordinate with Blue Zone to try to have them help with these, or are they separate?
They're separate, just because of fidelity to the program. But we do have, I think our oldest exerciser is 101. He's been there since he was 94. And still...
Wow,
so
amazing.
The changing face of aging, I think we're seeing, I don't know about you guys, but I don't look towards retirement to sit
No.
and just kind of be.
I don't know anyone that does.
I look towards retirement
Yeah.
as a chance to give back, which kind of brings it back to, the theme of the senior fair this year is to connect, create, and contribute, because we believe those three things together help people stay alive, living well longer. And our seniors are a different kind of seniors. They want to
Yes.
give back to the community.
They want to be engaged
Yeah.
in
Really?
the community. So
Yep.
it's very important.
And how do you help them get connected in that way? How do you reach out to them? And obviously, I'd love to do this through the radio show, but how do you let them know? Do you let them know through some of the other organizations, or through the Kaiser or HMSA, or how do they know about this?
I think we all try to engage with volunteers. I know you guys have the CSEP program, right? The
Oh, yeah.
Senior Community Employment
Program.
Program.
Very good.
It's actually a part of the Older Americans Act as
Yes,
well.
it is.
Is that? But that's no money. That's all volunteer.
No, that is
It's actually paid.
Yes,
No, yeah, they
it's
get
a
paid.
stipend. Yep.
Oh, that's nice to know.
So if there's a low-income senior who finds a need to enter or re-enter the workforce, they can actually go to MEO and receive on-the-job training
wow,
so
that's
that they can
wonderful.
then pursue employment, because that's another thing we're seeing. People are working longer
Absolutely
than they
true.
used to.
So if you're just tuning in, this is really important information. The 46th Annual Maui County Senior Fair is coming up Saturday, October 26th, 7:30 to 11:30. And Deborah Stone Walls with the Maui County Office on Aging is talking about what is available to help to make a difference in seniors' lives. And Janelle from MEO is here as well. She's the Community Services Director, and it goes on and on and on. She's, and ZILPAH KAIMIOLA with MEO is also here.
Yes.
And what we're trying to do is let people know that, this is the hardest thing that we really need to get out. You're never alone. You may think you're alone. You may feel isolated. And in some cases, I see heartbreaking situations where there are seniors in a house that a family member is taking care of. But that family member is doing it, but you can almost sense a sense of resentment. I hate to say that, but I have a neighbor, and I sense this little bit of attitude about having to come and keep an eye on the relative, right? Which they do. It's like, I got to go. But they don't. You don't have to just do that, because there's a lot of programs that are out there that can help, and there is a burnout factor that happens with loved ones of seniors who are at that point where they're
With
really-
caregivers.
Yes, with
Yes.
caregivers, and you've seen this happen, right?
Yes,
Yes.
absolutely. Absolutely. So what we try to do is put in assistance for caregivers who are feeling that burnout, to give them respite. So we have a variety of ways we can come in, and even just a little bit of time for yourself makes all the difference for some people. We know that 90% of spousal caregivers will actually die before the person for whom they're caring.
That's a huge figure, isn't it?
It is.
Yes. My gosh, that says something, doesn't it?
Yes.
And think of the guilt that then happens to the one that survives.
Yes.
And they were counting on that person, so there's a huge gap there that has to be filled at that point.
Yes. I think we're pretty fortunate in Hawaii, especially, though, when we think about the word kupuna and the reverence even that the word brings, right?
Mm-hmm.
We as a society here, we're far more fortunate than a lot of America, where our older population is really pushed aside, and the funding matches that reverence.
Mm-hmm.
So I would encourage people, if you're a caregiver, if you're a senior, reach out and get involved.
You have at
because
least
there's
2 or
help.
3 programs I've heard of where, we always see the MEO buses running around, right?
Yes.
You have many transportation opportunities for people to get out, don't you?
We do, actually. There's several programs, that I wouldn't cater, to the older population, seniors. There's a nutrition program, through Kaunoa. They have a leisure program that we provide transportation services to and from, So there's a lot of programs, that's directed for seniors. There's Maui Adult Daycare, and sometimes when people think about Maui Adult Daycare, you drop off your family member, and it's a daycare, where they're being looked after, but having to experience going into the facilities and seeing what they actually do, it's pretty amazing. Mm-hmm. They have a lot of activities, they have lunch there, they get to, make friends with other seniors there, so they don't feel
much
alone.
Better than just stuck in your house all day long, right?
Right, and they also do sightseeing trips.
They do sightseeing trips
once a month or something.
So it not only helps the members of the family, but it helps the family itself, where they can go to work and not have to feel the burden of and that can be challenging. So I think to avoid some of that, we want to encourage caregivers, families
to
reach out.
So there's lots of departments with MEO. You're big. I don't know how many groups. I mean, MEO has how many people? It's a very big organization, isn't it?
Yeah, we're continuing to expand.
Yeah.
And transportation is our biggest department.
Is it really?
Yeah, it really is. That's almost a 24-hour operation, 7 days a week. And they operate about 13, 14 different programs.
Wow.
Simultaneously, Monday through Friday.
That's a lot of. How many people are involved with MEO?
At MEO, I think we have a total of overall
employee-wise.
Employee-wise, over 200 employees.
Yeah. It's big. It's really big. So what's the best number when you call? Because in big organizations, if someone was going to call and try to get help, they might get lost in the phone system.
They get lost in the building.
When they get lost in the building, too. But what's the best way for people to reach out? They're listening and going, well, I could use some help. Maybe I should find out about this. What should they do?
Well, transportation-wise, they can call 877-7651. Transportation director is Harry Johnson. And there's a transportation administrator, Jerry Lum. So, you could call them. If you call the main number directly, anyone that answers the phone can help you with any of the programs.
And if you wanted some of the other senior programs, senior-related programs, would it best call the Office on Aging, or would it be best to call?
Well, we're kind of separate. Yeah?
I know. So which one would you suggest calling for people?
Well, I think if you
call Office on Aging.
Yeah. Well, I think if you want general information about everything available in the whole county for seniors, our office can help with that. We also have a searchable database online at Maui County ADRC.org. But yeah, we can help point people in the right direction, and they can tell us what they're interested in, and generally we're going to know where to help them get plugged in.
Do you still have that big book that was like a really thick book about all the different organizations tied in?
Yes, we do.
It was like 1.5 inches thick.
Yes, and that will be at the senior fair.
Oh,
we will have a copy for everyone who wants one.
Because it's pretty impressive.
Yes.
I mean, it's pretty mind-blowing of how much is out there.
Yes.
And I really do not think a lot of people know, how much is out there for them. And I have to ask, because it was such a touching thing that you said about people who are caregivers and also people with family members that could die before the others. When people go through a hospice situation where they've lost a loved one, whether it be a caregiver or relative or whatever, are they able to be directed right then for help to one of these organizations that could help keep them from getting in that terrible situation where they're totally isolated when someone that they love, who is either a relative or a caregiver, if someone dies, what do they do? I mean, that's got to be a very hard situation where someone's grieving and suffering and all alone and not knowing what to do. It's got to be extremely difficult.
Yes, and we can help with that. We can help people get connected to support.
Mm-hmm. Mm-hmm. I know HALE MAKUA and others also have programs.
Even hospice,
yes.
Hospice,
yes.
Maui Hospice.
Yes.
As well.
It's very important work, and I really am very impressed with the work you do. There's so much more, and I do recommend if someone can go down and go to your office. I was just there one time to talk to you, I know. I wanted to have you do, I think, a talk show a few years back. But it's if you go there and look at some of the books that are available, and the resources that are available, it's very, very impressive. And another good way to do is to go to the Maui Fair. This Maui Senior Fair is coming up again. It's 46 years, folks. October 26th, 7:30 to 11:30. If you're a caregiver, if you're a kapuna, if you have relatives who are, bring them. I guess is there shuttles and ways for people to get down if they don't have transportation to get down there? Is MEO providing any way to get to the senior fair? Do you know about that? Is there a way to get transportation?
Well,
there?
I know our clubs do have the free buses to get over there. So
Okay.
each club will plan who's going on the bus, and then we pick them up and bring them over.
Well, that's really, it's extremely important because, like you say, some of them don't get around that much. And, you know, the buses are improving with the county, but there's MEO, again, provides a service where you can pick people up at their home. Big difference because maybe you can't get down to a bus stop if you're a senior. Maybe you just don't have that ability. You might not be able to drive. And I heard this, it kind of blew my mind, that now the DMV is checking drivers every year. Is that true?
Older drivers?
Yeah.
I'm not sure.
Yeah. Well, wonderful, wonderful talking to you, great people, and I thank you so much for joining us. And right now I have on the phone a very important subject. It kind of ties in, actually, to what we were talking about. Hello and welcome. Thanks for calling in.
Hi, this is Craig Nakamoto from MDX Hawaii.
Hi, Craig. You called in right on time. We're going to be talking about a special event that's coming up. MDX Hawaii is an Oahu-based local company. It's been serving Hawaii for 35 years, a long time. And your MDX Hawaii, is it part of the Maui Medical Group?
No, but we're happy to be teaming up with the Maui Medical Group and the Maui Economic Opportunity to sponsor this Medicare 101 event.
And I have to say, it's really hard to understand what Medicare is. I mean, number one, the information booklet you send out. I haven't even opened it up. It was it was kind of intimidating. It was so big and it was so complicated. It's like, well, I guess this needs some clarification, and that's what you're going to be doing with a free seminar coming up, right?
Yeah. So, Medicare, just kind of going back to basics, and that's why we call it a Medicare 101. You're kind of going back to basics and presenting some information. It's really an educational opportunity. And Medicare is a federal program that provides medical and prescription coverage for people who are 65 years of older or have a disability. Now, that sounds simple, but in reality, Medicare can be very confusing and complicated, and it's not something that people think about or talk about generally until they're 65.
Well, you know what? Also, is it's very confusing about the way it interfaces with our. We all have some kind of insurance program, whether it's Kaiser, HMSA, and I don't understand how they interface. Really, truly, I don't understand how you use one, or if you use one, then do you ace out your opportunities on the other? And that part confuses me the most, I think.
Yeah, and those are and that's really one of the things that a lot of our people are 65 are still working, and some of them have coverage from their employer group, and some of them are at that point considering Medicare. So that's one of the topics that we cover is employer provided Medicare coverage and the Medicare coverage that you get in Medicare Advantage. So those are one of the topics that we're going to cover in the session. I think it will be informative to the attendees.
Well, I definitely think that's important. And there's going to be actually a couple of dates. Wednesday, October 9th, which is not that far away, 5:30 to 7:30. Where is that going to be held?
That one is going to be at the, I think it's going to be at the Maui Economic Opportunity.
Is that right?
Sure.
We have the
that
MEO,
is
two MEO representatives here, so they're filling us in here, which is important. Also Saturday. Now, I have Wednesday the 9th, Saturday the 12th. The Wednesday is the evening, 5:30 to 7:30. Saturday is 9 to 11. And are they the same topic, or are they different topics on those two dates?
I know that on the the Wednesday, the Saturday topic is going to be Medicare 101. On the Wednesday topic, I'm not sure what exactly the topic of that is.
And
maybe the MEO person can.
Well, first of all, let's just tell everyone where MEO is, because maybe some people don't know. So where are the MEO offices?
The MEO office is located on 99 Mahalani Street. You're going to ask, where is that? It's where the police,
Yes.
the Maui Police Department.
Right there.
Yeah, it's actually right above where the building, if you turn in to the lane where the Cameron Center is.
Yeah?
Yeah, where the building farthest towards the back.
So you're
on
right
the
in
left-hand
that same
side.
little thing where the wonderful little restaurant is also, and all that.
Simply Healthy.
Simply Healthy.
Cafe is
Yeah,
wonderful.
yeah.
Yeah. I didn't know you were back there.
Yes.
In that same parking area and everything.
Actually, we have our own parking lot area.
Oh,
but
you do?
We have our own building, so it's separate
Uh-huh.
from the Cameron Center.
Oh, it is. And is
Yeah.
but it's in that same complex where you pull in.
Yeah, it's on the same property, on the same site.
Well, that's good to know. So we just found out where that is. So I guess you can Google map it as well. And so we're going to be learning about how Medicare works, which is really, really important. Is this one thing that comes up, is that people just don't understand it and don't use it, and people may have some benefits coming or things that they can use that they aren't using because they don't understand it?
Well, I think it's something that at the time that, and this is an event that's not only for folks that are going to be aging in or turning 65, but it's also, an event for people who are already on Medicare and in some kind of plan. When you turn 65, we find that, people get inundated with a lot of materials about the different plans.
Yeah.
And it's hard to daunting to sift through all that.
Yes, it
And
is.
Sometimes these kind of Medicare 101 sessions really help to help people understand the coverage, the various costs, the differences between the different plans. And we don't, even though we're at MDX, we don't, sort of push one plan or another. It's an event that we provide information on Medicare 101 and
So you're
try to
going
help.
You're going to give information, even though a licensed insurance agent is there,
Yes.
that you're not going to have people don't have to worry about being pitched to buy
Yeah.
something, right?
Yeah, a licensed insurance agent will be there, and it's on Wednesday and Saturday.
So tell me about this, because I think that is a big issue. Probably one of the biggest is about the coverage and costs, right? So I mean, once you get this information about Medicare, are you automatically paying for it already? Do you have to pay extra, or how does it kick in compared to your other insurance coverage, your other health insurance coverage?
Yeah, so once you decide what you want, then there's cost and coverage for the costs that are with the different plans, and each plan and coverage is different, and sometimes the idea is that you go to these sessions and you learn which plan and which coverage is best for you, even for people that have Medicare coverage already. They may be looking, things change, the situation changes, and they may want to look for another kind of plan or coverage that is better suited to their situation.
So do you have to enroll in Medicare, or are you automatically enrolled in Medicare at the age of 65?
I think you have to enroll in it, and it's something that you have choices between sort of regular Medicaid, Medicare, or you can enroll in a Medicare Advantage plan.
So this is one of the issues I think that came up the most. I was doing a radio show for a long time with HALE MAKUA here. People don't understand the difference between Medicaid and Medicare. There's a lot of confusion about that. What's the difference?
So Medicare is for, as I mentioned earlier, it's for people age 65 or people with disabilities. Medicaid is for people who meet a certain income threshold, usually who make less than a certain amount of money income. Those are the people who are on Medicaid.
So, as I remember,
that's like in Hawaii, that's our Quest program.
So when someone has an issue or something happens and they have to go to a place like MAKUA or assisted home care living, then they would have to be able to be enrolled in a Medicaid program to have some of that. No? Medicare program? What program? Go ahead. I'm here with a lovely lady that I don't know if you know her, but you should. Her name's Deborah Stone Walls from the Maui County Office on Aging, and she's going to assist with this answer.
Okay.
So long-term care facilities can accept either private pay, and if an individual is qualified under Medicaid, they can then get enrolled in Medicaid.
And that would help assist with the cost.
Yes, well, with the Medicaid, it covers the cost of the long-term. Well, they don't have to pay any out-of-pocket. I think our facilities would tell you the reimbursement rate does not cover the cost, but families and the individual don't then have to pay. Medicare does not cover room or board.
Oh.
So Medicare covers health. It's like a health insurance plan. And even if you are working, once you turn 65, you have to apply for Medicare Part A. Even if you have a job with health insurance, you need to apply for Medicare Part A.
Or else?
Or else you can be penalized.
I didn't apply.
Yes.
Oh dear.
Oh.
They're at the door.
Uh-oh.
They're here to take me away right now.
So
I gave away my age.
So you should go to Social Security, and you have a window. So I don't know, Cindy, how long ago that was, but you do have a window that you can.
I didn't know that.
Apply
No, I
in.
really did not
Yeah.
know that.
And
I probably should have read what they mailed me.
yeah.
You should come to this session.
I think
Yeah.
I need to go to the
Come to the
sessions.
seminars.
Oh, gosh. But I bet I'm not alone.
Did I get that fact right, or is it only the folks that are in the union that have to apply for Part A?
Talking to you, Craig.
Oh, yeah, I'm not sure about that
Okay.
one, but I think that you're right. There are late enrollment penalties, and those are the things I think that the insurance are one of the licensed insurance agents is going to cover at the session.
Well, this is already confusing. And then there's the advantage plans that can provide more coverage and less out of pocket. But that means that you have to pay more than if there's an advantage plan. Is that right, Craig?
I don't know if that's necessarily right, but the Medicare Advantage plans provide, definitely, more coverage and less out of pocket.
And it depends too, Cindy, on your personal circumstances.
Yeah. Mm-hmm.
That's why, like our office, we have most of our staff they are certified Medicare counselors.
I didn't know
So-
that.
yes,
So you've got
how
that
about
down there
that?
as well.
Yes. So, if you go to the doctor a lot
Yeah.
and you have a lot of copays, an advantage plan might be the way to go, even though you may or may not pay a little for it. Some of the plans you pay for, some you don't.
Well, I'm on
So-
Kaiser, so I always pay, them, and they get a lot of my money.
Right. So
A lot of money.
it's just going to, there's a lot of details. That's why if someone helps you to walk through your particular situation,
easier.
the medications you take, different plans provide coverage for different medications, doctors. So people need to know which doctor's important to them, how often they think they'll go to the doctor, what medications they're on, because all of those pieces play into discovering what's the best plan for you.
Do you find, and I don't know if Craig can answer this, so you want to answer this, Deborah, there's limitations of what Kaiser's, I think, rather expensive plan is. But it doesn't include things like, chiropractor. It doesn't include massage. It doesn't include a lot of the things. So does Medicare pick up some things that Kaiser may not pick up? Do you know is that possible?
I'm not sure what
Okay.
Kaiser covers.
Yeah.
Doesn't cover.
But I can tell you that every Advantage plan has to meet or exceed the basic Medicare coverage. So if Medicare fee-for-service covers it, then the plans have to provide those basics, and then they
Wow.
can add on.
So there's some coordinating this going on here. This is at Craig. It's making me realize as I'm talking to you how complicated this is.
It is complicated, and I think Deborah brings up a good point too. That you know, and I mentioned this as your situation changes, you find out that you need different kinds of medication. That's why it's good to sort of shop and compare, even if you are currently on Medicare. I don't know if Deborah would agree with that, but I think it's as your situation changes, you might need want a different kind of plan coverage and structure.
Well, absolutely, I agree with you, Craig.
And then on top of that, I know a lot of people may not even think about these things till they land up in the hospital, or they get in a situation where the costs are outrageous, and they all of a sudden thinking, well, how am I going to pay this, As we know in this country, I think that's one of the major causes for bankruptcy, is health issues. And I think we're the only country in the world, actually, where has people that have to go bankrupt because they can't afford their health costs if they have a medical emergency, or their loved one or family member has a medical emergency. You can lose everything you have very, very quickly.
Very quickly.
If you land up in the hospital due to an accident or an illness that happens, And that's sad when that just happens. That is just heartbreaking to see people lose their whole lifetime of working income.
I think even before that point, it's just for people for people turning 65, and even for folks that have been in Medicare and are older, all the information that comes out about the different Medicare plans and Medicare Advantage plans is really daunting.
Yes, it is.
In my own situation, a few years ago, my mother-in-law was trying to look at all the different coverages, and I was trying to help her, and I realized how daunting that can be and challenging that can be for anyone, much less senior citizens, try to navigate their way through that. And these kind of information sessions, I think, go a long way to helping people understand the coverage, what they need.
Do you have to sign up, or can you just show up for these sessions?
It's recommended that they call to reserve a seat, but it is, a reservation is not required, but space is limited.
And it's free?
It is free.
So I guess the number I have here, I'm not sure if it's MEO or your number there. I have an 808-426-7600. Is that the number of MEO, or is that your number there? That must maybe your number over in Oahu?
Yeah, it looks like it.
808-426-7600?
Yep.
Yep. So that's 808-426-7600. You can reserve a seat that way for the Wednesday event, 5:30 to 7:30, at the MEO office, which is behind the Cameron Center there, or the 9 to 11, which I think probably be more popular one on Saturday morning from 9 to 11, which is one I think I'll go to find out what in the world is going on. Although if I went Wednesday, I could just hang out in your office, and Deborah, I could just learn for an hour or two what in the world this is all about, because it is rather. Like you say, there's a lot of personal differences, I guess, in every person's life and what they're getting and what they're doing and what their lifestyle is too.
Yes.
And as you were saying earlier, and we were all saying, a lot of seniors now are very, very active and do have jobs. Some into their 70s, 80s, and beyond, and have jobs, and I'm not sure even how that interacts with Medicare, et cetera, and what that involves. Are you going to be covering this at your senior fair as well, trying to cover some of these issues? Or there be a booth covering some of this at the senior fair?
Yes,
Deborah?
there will be a booth that's a SHIP booth, which
SHIP
is
booth?
Yes.
Okay.
For some reason, we're called shipmates.
Okay.
SHIP is the state health insurance program.
Okay.
So,
it's not a ship of fools then.
No.
Okay.
No. Well,
No,
depends on who's in it.
Okay.
But yeah, we will have Medicare information available as well. The open enrollment period is from October 15th to December 9th. Is that right, Craig?
Yeah, that sounds
Yeah.
right.
So that's coming up pretty fast.
Yes.
That's why you've timed it this way, right? Right, Craig? October 12th. That's just a few days before open enrollment. You know what confuses me more, though, Craig? As soon as we get into open enrollment, all of a sudden we're seeing ads on TV. There's all these things. You start getting postcards. You start, and it's like, I don't know who to believe. It's like this person's better. I start asking friends, and it gets really to be a maze of trying to figure out what's the right plan to do, you know, because it's hard. It's hard to know what the best one is, and you don't want to be on the wrong one, right?
And you can go online as well. I mean, you can go and learn at the sessions, and you can also look online.
MDXHawaii.com is one of the places, and you probably know some others as well, Deborah.
Medicare.gov.
Medicare.gov. Is it easier to read than their pamphlets?
You know, it's a no.
That's not okay.
No.
I
think it depends on the individual.
Well, you know, I think we need a translator. I think we need someone that could just kind of make all those pages down into a few paragraphs and explain, you know. I mean, there's got to be someone who understands the legalese and what's going on to try to say, if you're in this category, maybe draw me a little picture. If that's you, sign here. If that's you, you go there.
And I think that's one thing that MDX is working towards, that Medicare 101, to
Right.
kind of be that kind of help and support.
Oh, you're the translator, Craig?
We're gonna try. Our insurance agent is going to help translate. And I agree with the earlier statement that, you know, once open enrollment starts to come out, there's a lot of ads, and you get postcards and flyers, and that's the reason why we hold these Medicare 101 events. I feel like it's sometimes easier to attend one of these and kind of hear about the different plans and coverages than sift through all of these different postcards and ads. I think it seems easier that way.
Well, I think, any kind of help in the right direction is easier. And I was just down getting my skin tested because I've had skin cancer 4 times. But I was just down at the doctor's office, and we were trying to, someone in the waiting room, because there's such a large waiting, because we only have 2 dermatologists at Kaiser's. And they're nice people, but they're overloaded. Someone was saying, well, you know, Kaiser's better than HDMA. And I go, well, what if you go out of state? You know, then you don't want Kaiser, then you want HDMA because you want Blue Cross. And they said, oh, no, you can just make a call and change. But I don't think you can just, once you're enrolled in one plan, you can't just make a call and change, can you?
Only during the open enrollment.
Yeah,
period.
the guy was wrong. He said, no problem. You can just switch if you want to switch. And I didn't think you could.
There are some plans you can, but generally Medicare, once you enroll, you're with that plan for the next, until the next, yes.
Pressure's on.
Yeah.
My
So
gosh.
I think I don't know if Deborah, you would agree with this, but that's the reason why this kind of Medicare 101 event is also good for existing Medicare members to kind of see, does their existing coverage still good for them?
So there's another number locally here, Debbie Kabibi. If you want to talk to someone here on Maui, Debbie Kabibi's number is 249-2990. If we haven't confused you too much, or if we have confused you, call Debbie and say, I'm confused.
And our office, we have the Medicare counselors at 270-7774.
And you can find that through the Maui Office on Aging
Yes.
.org.
Maui County ADRC.org.
And you're down there, and walk-ins can even walk
Yes,
in and be
absolutely.
pointed in the right direction. So,
Absolutely.
Craig, I appreciate you calling in. And again, this is October 9th, evening, 5:30 to 7:30. October 12th on a Saturday, from 9 to 11. I appreciate you calling in. Thank you so much.
Thank you so much for having me on.
Yes, it's a pleasure. And I thank all you wonderful women here today guiding me through what's going on, and we'll see you at the senior fair, okay?
Sounds
Aloha.
good.
Sounds
And
good.
a
Thank
big
you.
aloha.
Mahalo.